23 signs. You have cancer. Cancer is a broad term for a complex set of diseases that can affect any part of the body, and recognizing the early warning signs can be crucial for early diagnosis and treatment. We will cover 23 warning signs of cancer. Stick around to the end because we discuss some lesser-known symptoms that can hint at the presence of cancer. 1. Persistent headaches that do not improve with treatment can sometimes indicate a brain tumor. While most headaches are not a sign of cancer, those that are different from your usual headache patterns, especially if accompanied by other symptoms like vision changes or nausea, should be evaluated. 2. Changes in vision, such as blurred vision, double vision, or a significant loss of vision, should not be overlooked. While these changes can often be attributed to benign conditions like age-related eyesight changes, they can also indicate brain tumors affecting the optic nerves or areas of the brain responsible for vision. 3. Another warning sign is unexplained weight loss. A sudden drop in weight without any changes in your diet or exercise routine can be an early indication of cancer, as the disease can affect your metabolism. 4. Unexplained nausea or vomiting can also be a warning sign, particularly if it's persistent and not related to other known causes like viruses or food poisoning. In some cases, these symptoms can indicate gastrointestinal cancers or brain tumors, as they can affect the body's balance and digestive processes. 5. Another sign to be aware of is difficulty urinating, including changes in the strength of the urine stream or a frequent need to urinate, especially at night. These symptoms can indicate prostate cancer in men or bladder cancer in both men and women. While these symptoms can also be related to benign conditions like enlarged prostate or urinary tract infections, it's important not to overlook them. If you are finding this content informative, please remember to hit the like button and subscribe to our channel. 6. A sudden or unexplained loss of appetite or feeling full after eating very little can signal cancers of the digestive tract, such as stomach or pancreatic cancer. These symptoms can lead to significant weight loss over time and may be accompanied by nausea or vomiting. 7. One of the most noticeable signs you might have cancer is a lump or thickening in the skin or breast tissue that feels different from the rest of your body. While many lumps are harmless, a persistent one warrants medical attention. 8. Similarly, difficulty swallowing, medically known as dysphagia, is a condition where you may feel pain while swallowing or may struggle to swallow at all. This experience can range from being mildly inconvenient to severely impeding your ability to eat and drink. If it persists over time or worsens, it can be an indicator of cancer. Dysphagia is often associated with cancers of the throat and esophagus. However, it can also be a sign of cancer in other areas around the neck and chest. For example, tumors in the lungs or thyroid may press against the esophagus, leading to difficulty swallowing. This symptom might start out as feeling like food is stuck in your throat or chest or that you are choking on food. Over time, it can progress to a point where swallowing liquids becomes difficult. The reason is, as a tumor grows, it can obstruct the pathway food takes to reach the stomach. Cancer can also affect the nerves and muscles that are essential for the coordination of the swallowing process. 9. Persistent indigestion or discomfort after eating could indicate issues in your esophagus, stomach, or intestines. When we talk about persistent indigestion, we're referring to that uncomfortable feeling in your stomach that doesn't seem to go away, even after changing your diet or using over-the-counter medications. It's that feeling of discomfort or burning in the upper part of your stomach that just lingers, making meals something you might begin to approach with apprehension rather than enjoyment. While indigestion is a common experience for many people and often isn't a cause for major concern, when it persists without a clear reason, it deserves a closer look. In some cases, this ongoing discomfort can indicate the presence of stomach cancer or esophageal cancer. These types of cancer can affect how food moves through your stomach and esophagus, leading to symptoms like indigestion. 10. A consistent cough or hoarseness that doesn't go away can be alarming, especially if you're a non-smoker. This could be an early sign of lung cancer. 11. Unusual bleeding or discharge from any part of the body is another warning sign. This includes blood in the urine or stool, which may appear as red or black, abnormal vaginal bleeding, or any other unexplained bleeding. Persistent, unexplained pain can also be a symptom of cancer, depending on its location and severity. While it's common to experience pain from various non-cancerous conditions, pain that doesn't go away or is associated with other symptoms like weight loss or fatigue could be a cause for concern. 12. Changes in bowel habits, such as persistent diarrhea or constipation, can also signal a problem. Blood in your stool, a significant change in the stool's appearance, or unexplained anemia, a lack of healthy red blood cells, are signs that something might be wrong in your digestive system. Most often, this symptom is associated with colorectal cancer, which includes cancers of the colon and rectum. Blood in the stool can appear as bright red blood or a darker maroon color, and sometimes the blood is not visible to the naked eye, but can be detected through a fecal occult blood test. Apart from colorectal cancer, blood in the stool may also indicate the presence of stomach cancer or esophageal cancer, as these cancers can cause bleeding in the upper parts of the digestive system that might not be visible until it is passed out of the body. 13. Persistent fever or infections can be indicative of cancer, as the disease can affect the immune system's ability to fight infections. Experiencing a fever or getting infections more often than usual can feel like just another part of life, especially during certain times of the year or under stress. However, when infections seem to never fully go away or keep coming back, it's worth talking to a healthcare provider, as it can be a sign of something more serious than just a stubborn virus. These symptoms can be the body's way of fighting against something that's not supposed to be there. In some cases, this could be cancer. Certain types of cancer, particularly those that affect the blood or immune system, like leukemia or lymphoma, can make a person more susceptible to fever and infections. This is because cancer can weaken the immune system, making it harder for the body to fend off bacteria, viruses, and other pathogens. 14. Swelling or enlargement of lymph nodes is a sign that often goes unnoticed. Lymph nodes are small, bean-shaped structures that are part of the lymphatic system, which plays a crucial role in your body's ability to fight off infections and diseases. Normally, these nodes are hard to feel under the skin, but when they're swollen, it indicates that something's up. This swelling can be due to a variety of causes, ranging from infections to cancer, which is why it's essential to understand what your body might be signaling. When lymph nodes become swollen or enlarged, and there's no clear infection to account for this change, it can be a sign of certain types of cancer. For instance, lymphoma, a type of cancer that originates in the lymphatic system itself, often presents with this symptom. Lymphoma affects lymphocytes, a type of white blood cell that helps the body fight infection. This can lead to noticeable swelling in areas where lymph nodes are concentrated, such as the neck, armpits, and groin. Another cancer that may cause lymph nodes to swell is leukemia, which is cancer of the body's blood-forming tissues, including the lymphatic system and bone marrow. In leukemia, the body produces an excessive amount of abnormal white blood cells, which can accumulate in the lymph nodes, causing them to enlarge. Swollen lymph nodes can also indicate that a cancer from another part of the body has metastasized or spread. For example, breast cancer, when advanced, can spread to the lymph nodes under the arm or around the collarbone, causing them to swell. Similarly, cancers of the lung, stomach, pancreas, and skin can spread to nearby or distant lymph nodes. 15. Persistent bone pain, particularly when it worsens at night or is not associated with any injury and does not go away with usual remedies such as over-the-counter pain relievers, may be indicative of bone cancer. It could indicate bone cancer that originates in the bones, Bone cancer is relatively rare and can occur in any bone in the body, but it most commonly affects the long bones in the arms and legs. Persistent bone pain can also be a symptom of cancers that have spread to the bones from other parts of the body, a process known as metastasis. Cancers that commonly spread to the bones include breast cancer, prostate cancer, lung cancer, and kidney cancer. When these cancers metastasize to the bone, they can cause pain and weaken the bones, sometimes leading to fractures. 16. Unusual fatigue that does not improve with rest can be a subtle yet significant sign. If you're feeling profound exhaustion that doesn't get better with sleep, it could be a sign of cancers such as leukemia or lymphoma, where the body's resources are increasingly consumed by cancer cells. 17. A new or changing mole on the skin is a well-known sign of skin cancer, particularly melanoma. It's important to follow the ABCDE rule for moles: asymmetry, border irregularity, color that is not uniform, diameter greater than 6 mm, and evolving size, shape, or color. Any mole that changes in these ways warrants a closer look by a medical professional. 18. Persistent sores in the mouth or on the tongue that don't heal within a few weeks can be a sign of oral cancer, especially in people who smoke, chew tobacco, or frequently consume alcohol. White or red patches inside the mouth or on the lips can also be precursors to cancer and should be evaluated. 19. A sudden change in the color, size, or shape of nails can indicate skin cancer, lung cancer, or liver cancer. For instance, dark streaks or white streaks under the nail, sudden clubbing, enlargement of the fingers and nails, or other noticeable changes should not be overlooked, as these can be signs of underlying health issues, including cancer. 20. Experiencing shortness of breath or difficulty breathing without an obvious cause like exercise can be alarming. While often associated with lung conditions, this symptom can also indicate lung cancer or lymphoma, especially if it comes with a persistent cough or chest pain. The last few signs are lesser-known symptoms that can also hint at the presence of cancer. These symptoms can be subtle and easy to overlook, but recognizing them early can be key to timely diagnosis and treatment. 21. Night sweats. Waking up drenched in sweat at night can be an early symptom of cancer, particularly lymphoma. Night sweats can be so severe that they require changing bedclothes or sheets. While they can be confused with menopausal symptoms or infections, persistent night sweats without a clear cause should be evaluated. 22. A change in the voice, such as hoarseness that persists for more than a few weeks, can be a sign of laryngeal, voice box cancer, or throat cancer. This symptom is often overlooked or attributed to less serious conditions, like allergies or a cold. 23. Puffiness or swelling in the face can sometimes occur in lung cancer, known as superior vena cava syndrome, where a tumor presses against the vein that carries blood from the head and arms to the heart. This symptom can be subtle and easily dismissed as related to other causes. It's crucial to listen to your body and not ignore these signs. Early detection of cancer increases the chances of successful treatment. However, having one or more of these symptoms doesn't necessarily mean you have cancer. Many of these symptoms can be related to other non-cancerous conditions. The key takeaway is to be vigilant and consult a healthcare provider if you experience any persistent changes in your health. Remember, early detection and prompt action can make a significant difference. Thank you for watching 23 Signs You Have Cancer on Healthy Vibrance. Don't forget to like, subscribe, and turn on notifications. See you in the next video.